Villa, there is a collision. This is on 132 east of Deep Lake Road. The expressway's traffic moves well right now on the Edens. It's 15 minutes either way between Lake Cook and Montrose. Kennedy looking good as well in both directions. Reversibles are open inbound. No delays to report on the Eisenhower. We do see delays on I-55 northbound Lorenzo Road to Blodgett. Farther north, you found Stevenson's a little tight approaching the Ryan. That's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next in our 1-hour heating and air conditioning weather center. Morning fog, very heavy out there this morning. Rain and a thunderstorm later in the day, high 61. Currently 42. Next news at 8. Chicago's Morning Answer with Dan and Amy continues next on AM 560 The Answer.
Listen to AM 560 The Answer online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560 The Answer.
Top of the morning, Dan and Amy. Maybe at her press conference tonight at 5 o'clock, Chicago Mayor Lori Lightfoot will repeat the call of Baltimore Mayor Jack Young.
Oh, yeah.
Please stop shooting each other so hospital beds can be used for coronavirus patients. That's one law enforcement strategy. And at the same time as so many of these big cities are releasing prisoners from prison and otherwise issuing directives that arrests will not be made for a whole list of crimes, as was done in Philadelphia. Well, that's already the practice in places like Chicago. Or at least they won't be prosecuted if they are arrested. Yes, interesting times.
Yeah, they're just asking gangbangers to put down your guns and stay at home.
Yeah. That's real effective stuff, isn't it? That's real inspired leadership from these people at the local level.
7 people were shot on Tuesday night, and they had 5 more confirmed cases of coronavirus. That's what the mayor, when he spoke to his people, that's what he said.
Yeah. As I said, inspired local leadership. Nonetheless, the good news is some good news out yesterday with respect to treatments as well as testing. Oxford University scientists report that they have a test for coronavirus that could give a result within 30 minutes and be taken by people at home. The report by the Telegraph across the pond there. The super sensitive test, which can pick up the virus in its very early stages when it might otherwise have been missed, which is important.
That's good.
Could be rolled out to testing centers within a fortnight. That's 2 weeks for you English speakers. And could be available for home use. So that's good news in addition to the expanded testing that's otherwise occurring, as was reported at the briefing yesterday by the president and his coronavirus task force, starting with Dr. Deborah Birx, who wanted to make sure people have context for the increase in numbers they're going to see with the expanded testing that's occurring and processing of those tests.
To every American out there, it will be 5 to 6 days worth of tests being run in 24 to 48 hours. So our curves will not be stable until sometime next week.
So patience is going to be required. I know that's in short supply at present. Also on the antiviral treatment side of it, there's some good news out of Japan, effectively. There's a report that a subsidiary of Fujifilm has produced a antiviral treatment that has produced encouraging outcomes in clinical trials in both Wuhan and Shenzhen, China, involving 340 patients. An official with the Chinese Science and Technology Ministry told reporters that it has a high degree of safety and it is clearly effective in treatment. Now, everything needs to be taken with a hint, at least a hint of skepticism from China, but nonetheless, the flip side is there was the possibility that the combination of a couple of drugs that are being used to treat HIV patients would hold some promise, and the New England Journal of Medicine reported that that is not the case. There was no observed benefit. So, science is innovating as quick as possible to respond to the crisis.
And we're going to do this. We can get through this.
That's it. and let's rely on the experts to tell us what we should understand and also to level with us about what we don't know when we're trying to figure out, because we're all adults and we can handle the information, even incomplete, because, we have to make decisions without perfect information. That's just life. For more on this, we're pleased to be joined by Dr. Gil Mobley. He is an emergency trauma physician, also a microbiologist, and missionary to Guatemala. Dr. Gil Mobley, thanks for joining us. Appreciate it.
Thank you, Dan. Good morning, Amy. Good morning, Chicago.
Good morning.
Thanks for joining us.
And so, I guess starting on the testing side, as well as the reports out of possible treatments and the trials that are being conducted with various experimental drugs, do you see the pharma community and the medical community responding with everything that they have to respond with as quickly as they can?
Yes, sir. We are stepping up to the plate thanks to the President's funding and final encouragement and realization. Unfortunately, the pantry is empty. Most of our supplies, reagents, and parts come from China. We've got to get down to the basics and start manufacturing this stuff immediately. That's going to take a presidential executive order, and he can do it.
Yeah.
And that was part of his invocation of the Defense Production Act yesterday.
Yes, that's good news. We needed good news. This has been a steady state of the worst case scenario, the perfect storm, day after day. Even this virus, even its contagiousness, gets worse. Every single week we learn another route that it is spread. And the most recent thing is it's aerosolized. That means if you spray deodorant, it becomes aerosolized. It becomes one with the air. If you spray deodorant in a room, it hangs out. It's suspended. This coronavirus does the same thing, like dust particles. On a still morning, you got a laser beam of sun coming through your morning room. You see the little dust particles.
Yeah.
That's what this thing does. It hangs around, and it's got these little spikes all around it, this little stucco, and it just is tremendously well transported with the breeze. Now, the good news is dilution is the solution to pollution. So distance.
Okay.
Don't get any closer than 10 feet if you're inside with someone else and they have a cold. There's lots of things we could cover, Dan and Amy, but the most important thing, if you think you have a cold right now and start off with fever and chills and it's lingering, you have COVID-19 till proven otherwise.
You may have
so do those around you.
You may have just replaced flatten the curve. Dilution is the solution to pollution. I can see that on social media and even on T-shirts at this point.
Absolutely. Open the windows. Open the doors. We had an outbreak in our clinic 2 weeks ago. We could not get tested. They said it was the allergies. They said it was cold. They had fevers and chills. My staff insisted on showing up. I sent them home, but we still opened all the doors to the clinics, all the window to the clinics, and practiced universal precautions as if we all were zombies. We were infecting them, and they were infecting us. That's what we must assume at this point if we're going to stop it. We are so far behind the curve, Dan. Amy, I'm scared to death. This is going to be worse than Italy unless we immediately play freeze tag as an entire country.
So just everyone on lockdown, shelter in place.
Lockdown, and that's the only hope. We are so late out of the gate. We are so far behind the 8 ball. We're the only country without any N95 masks. These are the simple, like the mucky mouse muzzle mask, not the big old things that you strap with canisters. These are the simple white things that are N95. You could have bought them at Menards. Unfortunately, Menards gave the last 100,000 to China when they ordered them 3 months ago. Too bad we didn't see that coming.
But didn't Vice President Pence say something about 3M providing 3 million of the masks that are otherwise used for industrial?
Where are they?
Okay.
They should have done this last December. Thank God we're ranking up production now. Same thing with ventilators. We are already short ventilators in this country, lacking parts even before this from the bad flu season, which probably was somewhat masquerading COVID-19 since December.
Well, so then with all the auto plants shutting down, President Trump wanted them to produce ventilators. Do you think that obviously that will help?
Absolutely, yes. We are capable of doing this. We have the will. We have the American spirit. We have, we are going to do this. The worst disease that has ever come my way has been HIV in my lifetime as a medical career. That thing attacks the immune system, but we tackled it. We've got people now with HIV going on for 35 years and healthy as an ox. We tackled that. We can tackle this. But right now, we have to save our hospitals. We have to save our health people. The next epidemic is going to be among the healthcare professionals. We've got to protect them. That means stop the surge. That means stay home. The hospitals will be, as they are not already are. The hospitals are gigantic cruise ship contagions. There's no way they aren't. Look, they say we could lose 1 million Americans to coronavirus. But what happens when the hospitals are shut down for the traumas, for the heart attacks, for the babies? What happens when I can't get my yearly doxycycline for Lyme disease? I get several times a year because I live in the woods. What happens? We're not going to get it. They're already starting to run out of psychiatric medicines.
Well, we heard from the CEO of the Cleveland Clinic the other day, and he suggested that right now, in terms of the healthcare infrastructure and its capacity, there is the capacity to handle the virus. And I don't think he was just talking about real numbers in real time. I think he was also contemplating the projected numbers and the projected numbers based on social distancing, not the projected numbers like the Imperial College London study that was projected based on doing nothing. And of course, we're not doing nothing.
Well, Dan, we're far from social distancing, and I don't think we're going to be able to go through the draconian measures that China did, let alone South Korea. They said they brought it in South Korea. Well, let me tell you something. Americans got a will, they got a spirit, and they love money, and they're not going to snap to without a draconian lock in place. You know, come on, just look at the streets. They're as busy as they've ever been in Springfield, Missouri, and a lot of other places.
Well, Missouri's different. My sister lives in Missouri, and I don't think they've shut all the schools down.
Not a bit.
And they still can go and, go to the restaurants, and they have plenty of toilet paper. So, but they only have
the
three
toilet
cases.
paper's gone.
Oh, well, yeah, but there's only three cases.
Seriously, these people need to wake up.
So this is predicated on modeling, and also there's the desire to get more of this testing done for all sorts of reasons, including to inform the modeling about just exactly how widespread it is,
how far along we are.
Right, and also
Fauci says we're always 2 weeks or a month further behind than where we think we are.
Well, that's right, but also things like the lethality rate, and by the way, just on that score, if it's true what was, again, one hypothesis, that as many as 85% of infected people are asymptomatic, then that would suggest a lot lower fatality rate than is otherwise being projected at this point.
Absolutely. That's the darn truth. Yeah, those that are going to the hospital have a grim course anyway. And the good news, Dan, about that is that's going to get us herd immunity. As soon as we have a large percentage that are immune in the herd, in the population, boom, those that haven't got it yet can go out confidently, just as we have pretty much herd immunity for a lot of things that we're not going to pick up outside the community anymore, just like hepatitis A. Most of us have been vaccinated. We don't have to worry about it. So there you go. There is good news, Dan. There is good news, Amy. Just pray and hope and stay the hell home. Stay the hell home, people.
All right.
I don't feel better after this conversation.
I have mixed emotions. I got to tell you.
That's right. We need to hear the truth.
But I do like dilution is the solution to pollution.
To pollution.
All
Amen,
right.
brother, sister, Amy, Dan, Chicago folks. Man, you blew me away saying quit shooting people, keep the ERs open for the COVIDs. God, wow. Bless you folks up there. One of the finest cities on the planet, I think.
Dr. Gil Mobley, emergency trauma physician, microbiologist, missionary to Guatemala. Dr. Gil, thanks for joining us. Appreciate it.
At Dr. Gil Mobley at Twitter. At Dr. Gil Mobley. 10 items you absolutely need for this dystopia we're going into. At Dr. Gil Mobley, a video. Thank you, guys.
All right, we'll do.
Watch that with the boys. And he joined us on our turnkey.pro answer line.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
When you're serious about your concealed carry training and education and are ready to learn from an active police officer with a teaching degree, check out Illinois Concealed Carry Training in Midlothian. You'll learn safe, responsible firearm use, home defense planning, conflict avoidance, situational awareness, and how to remain physically, morally, and financially safe in the event you must use your firearm in self-defense or the defense of another. Weekday and weekend classes available. For information, visit Illinois Concealed Carry Training online at ICC.